Are you curious how to do an ergonomic assessment? Today, I'll be telling you all about it. So first off, when you're working with your client, you always want to start at the person's feet and work all the way to their head. Feet should be resting flat on the floor with good, comfortable shoes. Knees, hips, and elbows all should be at 90 to 100 degrees. So go back to the knees, make sure knees and hips are at 90 to 100, and make sure the seat pan is 1 to 2 inches away from the back of the person's knees while getting good lumbar back support too. With your hips at 90 to 100 degrees, you should also be getting good back support from your lumbar spine all the way to your mid-shoulder blade. If you have a client that is pregnant, you can recommend a seat pan that slopes slightly downward to open up the hip joint and allow for more space for baby to grow. For armrests, these should be at a position where your elbows can rest at 90 to 100 degrees while getting good lumbar and upper back support and to be able to comfortably rest in the chair. Once all of these items are set, then you can turn your client to the workstation. So a keyboard and mouse. The keyboard and mouse should be at a position where it is 1 inch below the elbow height. The reason for this is so you can be able to rest your arms on your armrests and type with your fingers in a downward motion while your wrists are free floating and not pressing on a hard surface. There are those soft gel pads that you can rest your hands on. It should only be the palm of your hand that is resting on those pads. Avoid pressing your wrist on those pads. Ideally, it's best to not rest your wrists on anything and just have your wrists free floating. Make sure your keyboard and mouse is close to avoid an extended reach. So sometimes that can be even pretty close to the person's stomach, not touching, but within close proximity. If your client is reading paper documents, then you want those to be propped up at an angle right in front of their line of sight. And as far as monitors go, you want the top frame of the monitor to line up with the person's eyebrows, or some people think of it as the top third section of the monitor to line up with the client's eyes. If you're using 2 monitors, then you can have a primary monitor with one in front and a secondary monitor off to the side at a 30-degree angle. While the 2 monitors are touching, avoid any gaps in between. If you use both monitors equally, then the 2 monitors should be centered in front of the client. So where the 2 monitors meet, that lines up with the person's nose and spine. Again, that is angled at 30 degrees. Also be sure to keep commonly used items within the person's golden zone to avoid extended reaching. So if they're answering phones or taking notes, those should be within close proximity. Also, always be sure that your client is able to get up for 5 to 15 minutes per hour to stretch, move about, and walk around. If you do run into a difficult situation, feel free to contact us. We're here to help with your ergonomic assessments and any other ergonomic needs. For more ergonomic tips and tricks, follow us and subscribe to our pages. Thank you.